Hello, my name is Allison Pennington, and for my fieldwork experience, I spent 2 days at the Pender County Health Department Farmworker Health Program. The Farmworker Health Program is eligible to any individuals who in the last 2 years has worked primarily in farm work. Farm workers can work in other areas during the off-season, but primary income must come from farm work. Dependents of farm workers are also eligible for this program. Last year, the Farmworker Health Program served 785 adults and children. Their goal for 2015 is to serve 1,000. When Natalie and her team go to camps, they report that about half of the clients are new and half are old. They get most of their clients through referrals and word of mouth. The peak season in Pender County is May and June, with blueberries and strawberries being the primary crops. Services provided by the Farmworker Health Program include home and camp visits, referrals to economic, medical, and dental care, financial assistance program for dental, optometry, and other specialty services, prescription assistance program. They work closely with the pharmacy close to the Pender County Health Department, and many farm workers are able to get their prescriptions for only $4. Transportation assistance, which I'll talk some more about later, diabetes classes, which I'll also talk about a little bit more later, and case management. The Farmworker Health Program receives funding from the North Carolina Farmworker Health Program. The goal of the North Carolina Farmworker Health Program is to improve the health of migrant and seasonal farm workers and their families by providing funding, training, and technical assistance to a statewide network of outreach and healthcare providers. The North Carolina Farmworker Health Program receives their funding from Health Resources and Services Administration, which is part of the U.S. Department of Health and Human Services. Natalie Hyatt is the outreach coordinator at the Pender County Farmworker Health Program, and she has 3 staff members that work with her. I spent 2 full days working with Natalie and her team. My first day started working at the dental clinic. The dental clinic is located within the Pender County Health Department building, and certain days of the month are set aside for clients of the Farmworker Health Program. Periodontal disease and extractions are the most common services provided, with many patients needing multiple cleanings. This is why it is good that multiple days a month are set up for clients of the Farmworker Health Program. Patients are responsible for paying a small copay for cleanings and extractions, but root canals, partials, and full dentures are not covered. Natalie explained that some patients are able to save up money and pay for root canals, partials, or dentures, but these clients are typically single men who do not have families that they need to provide for. Later that afternoon, I helped prepare bags for the team to take to a farm that they were going to be doing a visit at the following weekend. These bags contained simple toiletries like toothbrushes, toothpaste, and also condoms and brochures with information about the Farmworker Health Program and other services available to farm workers. After that, I went on a home visit to 2 families with Natalie and her team. These families were enrolled in the program in 2014, but needed to be re-enrolled for the 2015 season. A health questionnaire was provided for each family member. Height and weight was also calculated in the BMI for each family member. The questionnaire also identifies needs for medical, dental, and financial needs of each family member, and if applicable at this time, assistance to enroll in the Affordable Care Act is provided. The next day, we started to prepare for the diabetes class that would be happening later that night. The diabetes class was taught by a nurse educator from the Pender County Health Department and interpreted by one of the staff members. A flip chart provided by the American Diabetes Association was also used. The class is going to be a series of 3 classes, with the first one being what is diabetes. The second class is going to be about diet and exercise, and the third class about monitoring. So for the first class, what is diabetes? We spent just time talking with the clients about what they know about the disease and what else they needed to learn. The main focus of the class was learning about portion size and appropriate foods to eat. To help teach this, we spent the part of the afternoon cooking a meal of chicken and rice and a salad to bring with us. This way we could have a visual aid of what an appropriate food's portion size was, and we explained how we prepared these foods. Barriers for farm workers. When asked, Natalie and her team explained that language barrier is the primary barrier of the farm workers. All the staff members of the Farm Worker Health Program speak Spanish fluently. Any place that receives federal funding is required to have an interpreter available at all times. However, this is not always the case. But specialty services such as an orthopedic surgery office is not required to have an interpreter or interpreter services present. Home visits were conducted completely in Spanish while I was there, and any written information provided to the clients was also provided in Spanish. Transportation is also a primary barrier, as identified by Natalie and her team. Many clients do not have access to transportation, or they live in rural areas where public transportation is not available. While I was there, one staff member provided transportation for a client to an appointment in Wilmington, which I thought was great. Also, Natalie went and picked up 3 clients to bring to the diabetes class, which if she had not done that, they would not have been able to attend. Education. During the diabetes class, it became very evident that further education is needed. We played a game called Fact or Myth. We simply stated information about diabetes, and the clients were provided with pieces of paper to hold up with either fact or myth on it. And many clients were misinformed about diabetes. Because of this, I think it can be deduced that education is needed for other chronic illnesses. At this time, there's no plans to provide classes for other illnesses such as diabetes, but this might be something that they do in the future. The home visit also provided an opportunity for education. One mother stated that her 4-year-old no longer was using a car seat because he did not need to be in one. At this time, the Farmworker Health Program team members explained to her that the need for a car seat is not based on age, but more on height and weight, and that this particular child still needed to be in a car seat. The mother was very receptive to this information and stated that she would fix that. Access to healthcare is another barrier for farm workers. The long hours of farm workers create a barrier to make or keep medical appointments. To remedy this, starting in April, a clinic located on the Pender County High School campus will be open from 7 p.m. to 9 p.m. to accommodate farm workers. A nurse practitioner from the health department will be providing the medical care at this clinic. Outreach program staff will be present to provide interpretation services and case management. Some recommendations that I have after this experience include developing cultural skills when working with migrant and seasonal farm workers. Patient satisfaction and healthcare utilization can be increased when healthcare providers are able to incorporate aspects of their patient's culture into their care. And also, mobile clinics have been found to improve accessibility and utilization of health services by migrant and seasonal farm workers and appear to be successful based on case descriptions and anecdotal reports. As I work to become an advanced practice nurse, these are some of the things that I have learned from my fieldwork experience. I need to be open-minded and learn to incorporate different methods of providing healthcare to meet the needs of my patients. Learning to understand the culture of my patients to provide competent and appropriate care is also important. I would also like to explore options to learn Spanish. I was clearly at a disadvantage during this experience because I did not speak Spanish. While Natalie and her team were very good about explaining what they were saying and what was being said, it would have been much better if I was speaking Spanish. I think this is also something that many healthcare professionals should look into because Spanish is becoming a very dominant language in the United States. Thank you.